Hi there, I'm Captain Dan Cohen with Williamson County EMS, and I am here with Dr. Tanya Glenn.
Hi, I'm Tanya Glenn, and I'm super delighted to be here.
So today on Rescue You, we're going to talk about PTSD. So Tanya, what do you think about ketamine therapy for PTSD?
That is a big question we get asked a lot these days. I know when people are suffering from PTSD, they're always kind of looking for what is that quick fix, right? And ketamine therapy, ketamine infusions have evolved as a treatment option. The thing about ketamine infusions is that while it suspends the emotions and the intensity of the manifestations of trauma, it doesn't fix the problem. So, do we see patients who are doing ketamine infusions? Yes. Is it the only treatment? Absolutely not. As I've said many times throughout, my education series and my books, is that we have to get in and we have to really kind of wrestle with those demons and get the brain to process the trauma, which you see, hear, taste, touch, and smell. We need to get the brain to process that effectively, and that is the true fix for PTSD. Without the work in therapy, the ketamine infusions will sort of hold you in a sort of suspended state and really pretty much manage the manifestations, but when it wears off, you're back in. And so certainly if you want to try it, you can, but it's not the golden just quick fix of PTSD.
So the ketamine just provides a respite, if anything.
Yeah, that's a really good analogy.
And is ketamine treatment widely used, widely available? I know in EMS we use it for a lot of different things. It used to be just a horse tranquilizer, as far as I knew, and now it is used for all sorts of things. How common is it to be used in conjunction with other therapies that you see?
So what we've noticed in the past couple of years is that ketamine clinics have really popped up. They're pretty common. We get a lot of emails from ketamine clinics wanting us to kind of endorse them. And so we've kind of remained neutral about it. I have, again, in dealing with people who've had it, they say, for a while there's some relief, but it does come back. So my biggest worry with first responders is that you just want that to fix it, and you don't want to come in and kind of tackle the demons with us. And if that's the case, then you'll get some relief, but then you'll be back in for the next infusion.
Got it. Okay. So ketamine might be a Band-Aid, might help, but it's not a cure-all.
Right.
Got it. Okay. Another question about PTSD. How do we differentiate anxiety, a mental health issue, etc., from PTSD? So how do we know it's PTSD?
So the thing about post-traumatic stress disorder, and I want to talk about the D disorder, which is sort of the end of the continuum, and then syndrome, which is important to understand as well. So if you have post-traumatic stress disorder, your ability to function is really, really altered. When people have PTSD, what happens is the trauma, as we've described in our previous trainings, is basically captured by the frontal lobe, and it doesn't allow that trauma to process like normal information. And so people who have post-traumatic stress disorder have very, very invasive recollections of the trauma. And it causes this state of just constant hyperarousal. And then they spend a lot of time and energy just trying to control this and manage it and stuff it. The D disorder is pretty severe. I think it's very overused these days. I think a lot of people have decided they have PTSD from this and that, and it really does require an event that puts your life in jeopardy, or your life of your partner or someone you care about, or when you see like carnage and mayhem. So the D disorder is very, very debilitating. And what I always tell people is, trust me, you would know, because your life is so hijacked by images and flashbacks and recollections and nightmares and night terrors. And so it's a really uncomfortable state to live in. The post-traumatic stress syndrome is what you guys primarily are dealing with. This is when you have a tough call and you notice over time, you see it, you hear it, you smell it, you nightmare about it, it bothers you a lot, and you think about it every time you're driving towards where it happened. What happens with post-traumatic stress syndrome is the healthy, resilient brain basically is able to overcome this, and it's able to process and push the event from your frontal lobe to your long-term memory. and it resolves itself. And this is what's happening pretty much 99% of the time with you guys. Now, because post-traumatic stress syndrome resolves itself, if you Google it, it always says, so you don't need to get help. But you know what? If you're experiencing a rough call and you can't shake it, come on in and get help. If you come in soon, it's post-traumatic stress syndrome. If it's going to transfer on to post-traumatic stress disorder and become more problematic, let's just nip it in the bud right away so that you don't have to deal with this forever.
That sounds like a good way for public safety folks to think about. A bunch of type A personalities like me and like other folks in our business. That makes a lot of sense. We're definitely nip it in the bud kind of people.
Absolutely.
That makes a lot of sense. Outstanding. Thank you for watching this episode with us and talking with Dr. Tanya Glenn about PTSD.
If you have any questions you want to ask us on Rescue You, go ahead and scan this QR code and send them to us. Please understand, in no way is this a counseling session or any sort of clinical advice. If any of the content has triggered you, or if you feel like you need help immediately, please reach out to your local mental health professionals or to any of your support teams that you have in your area. If you're in a crisis, here are some national resources for you to contact immediately.